The purpose of this video is to demonstrate IV push piggyback medication demonstration using our electronic health record that we're going to use in our SLS learning system. The first thing you want to do is make sure that you log into your Evolve account. Then you will click on your simulation learning systems. You will scroll over on the left hand side to choose the patient who has been assigned to you. You will open the simulation. And at this point, we're going to check to make sure that we have the correct patient pulled up, and we'll check the orders and check the MAR to make sure that it is the right medications. So this is Charles House, date of birth 5/2. He's 56 years old. There are no drug allergies. I'm going to look at provider charts and provider orders to see what medications are due. And I see a new order has been written for Claflin 1 gram IV Piggyback now, and also on Danzatron 4 milligrams IV push every 6 hours PRN for nausea. And those are the two medications that we're going to give. So now I'm going to look in my MAR, make sure that those are the correct medications listed. And I still have Charles House pulled up, date of birth 5/2, 56 years old, no allergies. And I see my Claflin 1 gram IV Piggyback, and that is to be given now. I also have the Danzatron or Zofran 4 milligrams IV push every 6 hours PRN, and we're going to administer that now. And the patient also has normal saline infusing at 100 milliliters per hour in the room. So now I'm going to do my math problem to determine how fast I'm going to give the medications and how much med I'm going to pull out of the vial for my IV push. So I need to look in my drug book. I'll start with my Piggyback, which is the Claflin. The rate of administration is a single dose over 30 minutes. So I have pulled the Claflin here. I'm going to compare it to the MAR to ensure that it is the correct medication. And I have Claflin 1 gram, and it is IV Piggyback. It is mixed in 100 milliliters of normal saline. There's no cracks or leaks in the bag, and the medication is not expired. So to set up my math problem, I will need the 100 milliliters from this bag. I'll also need a secondary IV tubing set, and I will get my drop factor from there. And then the book stated it should be infused over 30 minutes. That math problem comes out to 50 drops per minute. Now I will look at my IV push medication. This, comparing it to the MAR, make sure that it is the correct medication. So I have on Danzatron, it is a 4 milligram per milliliter vial. It is not expired. I need to look to see the rate that I'm going to push this medication. The IV drug book states that a single 4 milligram dose can be given over 30 seconds or 2 to 5 minutes. So we're going to go kind of in the middle there and give a safe 3 minutes. You also want to decide how many milliliters you're going to push over each minute. And so I've divided the 1 milliliter into that 3 minutes, and it comes out to about 0.3 milliliters every minute that I will give. And we'll look at that in just a minute. Okay, now that I've compared my medications and I have the rates that I'm going to administer, I'm going to look up any other pertinent information that I need to know as the nurse, and then also that I may need to tell the patient. So the first thing I'm going to look at is my Claflin, and it says a safe dose is 2 to 12 grams every 24 hours. This patient is getting the 1 gram in this 24-hour period, so it is a safe dose. It can be diluted in sterile water for injection, D5W, normal saline, or any other compatible infusion solution. It can be further diluted into 50 or 100 milliliters of that compatible solution. Also, the patient does have the normal saline infusing in the room, so it is compatible with the primary solution. And the dilution is also 100 milliliters of normal saline, so it is correctly diluted. We've already spoke about the rate of administration, which will be over 30 minutes. It is indicated as treatment for lower respiratory tract infection, urinary tract, skin and skin structures, and intra-abdominal. It is contraindicated with patients who have had a hypersensitivity reaction to cephalosporins. We also want to, for precautions, it can cause Clostridium difficile, so we're going to be monitoring to make sure the patient doesn't have any reported diarrhea. We're also going to be monitoring for renal function, so we'll look at BUN and creatinine levels, as well as drug serum levels during treatment. For my ondansetron or my Zofran, the usual or safe dose is 16 milligrams, which is a maximum dose. So 4 milligrams is a safe dose and can also be given undiluted. It is compatible with D5W, normal saline, D5.5 normal saline, D5 normal saline, and also 3% sodium chloride. We are giving this medication undiluted, but it is compatible with the normal saline that the patient has infusing in the room. Rate of administration, we looked up and we're going to do that over 3 minutes. This medication is indicated for prevention of nausea and vomiting. It is contraindicated with any patient who has had a sensitivity to this medication. During treatment, we're going to be monitoring for hypersensitivity, also monitoring for orthostatic hypotension. So I will educate the patient on ambulating slowly. We're also going to be monitoring for signs and symptoms of nausea or worsening nausea and vomiting. We'll also look for signs and symptoms of bowel obstruction with patients who are getting a prolonged use. Now I'm ready to prepare my medications. So I'm going to wash my hands. With your IV push, you want to make sure that you pull the correct size syringe for the medication. Because we are pulling the whole 1 milliliter from this vial, the smaller syringe, 3 milliliter syringe would be appropriate. Want to make sure we scrub the top of our vial 15 to 30 seconds. Pull back your air of 1 milliliter. You're going to inject your air and then withdraw the appropriate amount of medication. Okay, and now I'm going to label my syringe. You want to make sure that you put the patient's name, date of birth, room number, your initials, the date and time, and then also what type of medication and dilution is inside the syringe. All right, now we're going to get our Piggyback medication ready. So I need my Piggyback med, and I also need my secondary tubing set. Whenever you open your secondary tubing, make sure to go ahead and clamp so that when you prime your tubing, there will not be any air. You want to make sure that you keep your clip. Okay, I'm also going to label my Piggyback med. So I want to make sure that I've got the medication that's in the bag, the patient's name, date of birth, date and time, and my initials. And I'm ready to go in the patient's room. So I will take my medications with me. I will also take my computer, my electronic health record with my MAR. Hello, Mr. Charles. My name is Christy Dickerson. I'm going to be your nurse today. Can you tell me your name and date of birth? At this time, I'm going to check his armband, and it's Charles House. Date of birth 5/2. He is 56 years old. Mr. Charles, do you have any allergies? And he has no allergies. So I'm going to also pull up and make sure that that is correct as well in my MAR. Charles House, I'm going to be giving you 2 medications today. One med is for your nausea. It is Zofran or ondansetron, and I'm going to give it through your IV line. And you don't have any allergies, but please let me know if you start to feel dizzy or itching or anything while I'm giving this medication, okay? The other med is called Claflin. It's an antibiotic, and we want to make sure that you also do not have any hypersensitivity or allergic reaction to this. So as it's infusing in your IV, if you'll please let me know if you start itching or burning or anything, and we're going to stop this medication. I'm going to go ahead and just hang this up here. Okay. And looking at the armband, it is still Charles House, date of birth 5/2, no known allergies, and 56 years old. I need to scan the medications before I administer. So I will start with the Claflin. In this electronic health record, you will go to the medication that is due, and you will click on the green dot that is on the right hand side. Once that comes up, you will click in the box for the patient ID, scan the armband, or you can type in the patient's ID number. Okay, the patient's name and date of birth should come up there, and then you can scan the medication that you're going to administer. You'll type in your administration time. You want to make sure that you look at the time that's on the actual electronic health record for your administration time. In the comments, you have to put your start and stop time there. So we're starting the med, and then it is going to infuse over 30 minutes. So you can do your 30 minutes for that, and then your initials. And then you will save your documentation. Okay, the next medication is going to be my Zofran. So again, it is showing that it is due. I click on the green dot. Click in the patient's ID box, scan the armband or type in the patient's identifying number. Then I'm going to scan the medication barcode. I will put in my administration time, my start and stop time. This method is going to be pushed over 30 minutes, so you want to ensure that you include that, and then your initials, and save your documentation. Okay, and now you are ready to administer the meds. First thing I want to do is I'm going to wash my hands, and I'm looking at the patient's IV site. I want to make sure that there's not any redness, any swelling, any signs and symptoms of infection located here, and his IV site looks good. I'm also going to lower the primary infusion bag below the level of the arm. I want to make sure that I get blood return to make sure that the IV is patent. Now for my IV push medication, I'm going to be administering in the port that is closest to the patient. We're going to scrub the hub. And because this patient does not have an INT and they do have primary fluids infusing, we do not have to use gloves, but we could use gloves if we wanted to. We just have to make sure that we wash our hands. Okay, during this process, because these two medications are compatible, I'm going to clamp the primary infusion while I'm pushing the med, but then I'm also going to unclamp and let the primary infusion flush the med to the patient. So this is going to be over 3 minutes. So we said we're going to do about 0.3 milliliters every minute. So I have the tubing clamped, and I'm going to slowly push that 0.3. And then I'm going to unclamp, and I'm going to wait my minute. At this time, the primary infusion is flushing the medication to the patient during that minute. We're going to be monitoring the patient at this time for any signs of hypersensitivity or infiltration of the site. Okay, after that minute is complete, we will clamp the line again. Push the second 0.3 milliliters slowly. We will unclamp the infusion. Wait another minute. Once that minute has passed, we will clamp. We will slowly inject the remaining 0.3 milliliters. And unclamp the primary tubing. We're going to wait a minute, and we're also watching to make sure the patient is tolerating it well. There's no hypersensitivity. There's no swelling of the IV site. You also monitor the patient at this time. Mr. Charles House, how are you feeling? Your IV site, is it still pain-free? Okay. All right, and now we're going to give the Piggyback infusion. Okay, so I've already checked the patency of the line. I already know the patient's not allergic to this medication. We need to lower the primary infusion bag. That's what we're using our hook for. With a Piggyback infusion, we're going to connect it to the port that's closest to our primary infusion bag. This port here. Scrub the hub. And connect. At this time, we're going to open the secondary tubing clamp all the way. We are going to regulate our drops using the primary tubing's clamp. We said we were going to do this in 50 drops per minute. So if you divide that out into 15-second intervals, it comes out to about 12.5 drops per second. We're going to get about 12 drops, a little over, in 15 seconds, and then we're going to count for the full minute to determine if we have the 50. Okay. Okay, so I've got a little over 12 drops within that 15 seconds. So now I'm going to check it by counting for a full minute to make sure that it is 50. All right, once you have your drops calculated for that full minute, remember this medication is going to be infusing over 30 minutes. So when it's completed, we will go back into the room. I will clamp off that secondary med, disconnect it from the primary infusion, and regulate my primary infusion back to the original physician's orders. I'm also going to be asking and checking on the patient. Mr. Charles, do you have any itching or swelling or anything going on? No, he feels fine. The IV site is still in good condition. There's no swelling or inflammation noted to the IV site as well.